A Look at Seniors is underwritten by the generous support of Hudson Headwaters Health Network, dedicated to provide the best health care and access to that care for everyone in our communities. Serving all of Warren County and parts of Clinton, Essex, Hamilton, Saratoga, and Washington counties. A Look at Seniors is underwritten by the generous support of Retirement Solutions. Our knowledgeable and experienced team will help you explore retirement options for a smooth financial transition toward a secure, comfortable, and worry-free quality of life. Retirement Solutions, providing you with a greater peace of mind when it's needed the most. A Look at Seniors is underwritten by the generous support of the Wesley community. For nearly 45 years, the Wesley community has provided services and programs with a commitment to compassion, caring, and excellence. The Wesley community, a senior living community that feels like home.
Welcome back, everyone. Next installment on A Look at Seniors. And my co-host, Lois Celeste, is at a convention, so I'm going to handle this one on my own. It's a really amazing topic. And as we go through this interview, I think that you'll just, number one, you'll just totally agree with me. And you'll also understand a little bit more about what it means to set goals in your life to make certain that you can live as well as you want and can live as long as you want. And joining me today are two experts in a topic called palliative care. And this is Mary Stein, who is a nurse practitioner at Hudson Headwaters Health Network. Welcome. Very nice to have you here.
Thank you. Nice to be here.
And Dr. Susan Blood. And you're going to have to give me the title, Sue.
Yeah, okay. I'm Chief of Geriatrics and Palliative Care for Hudson Headwaters.
Great. Well, welcome both of you.
Thank you.
Some of you out there I know are thinking to yourself, palliative care, what is that? It's actually something that's new to a lot of us, but the practice itself has been around for a long time. And just in layman's terms, it's the idea that between you and your primary care, if you're suffering from a serious illness, it could be cancer, it could be Parkinson's disease, it could be congenital heart failure, it could be dementia, it could be Alzheimer's disease. There's a level of anxiety there that dials itself in that affects not only the person inflicted, but also their caregivers, their family, and anyone affiliated with them. And the idea here is the palliative care team comes in as that liaison in between to listen, to help you understand, help your family understand, and to provide you with the kind of support that will allow you to live as well as you can and as long as you can. You know what, Mayor? I'm going to start with you. As a nurse practitioner, we always use the term in our field, you're in the trenches. You know, you're in the field. You have that wonderful one-on-one with people. Given what I said, what is it like to provide this kind of care for someone?
It's the first things that come to mind is it is an honor and a privilege.
Oh God, that's wonderful.
It's amazing to be in a room with someone and have the time, either in their home or in the outpatient palliative care consults that we do in our center, in the center that we have at West Mountain. It's amazing to have the time to be able to deal with the symptoms and stress that come with having a serious illness.
You know, when you think about a serious illness, Sue, you know, we tend to think, okay, you go to the doctor, you're diagnosed, and you're prescribed certain medicines and things like that. We're human beings, right?
Absolutely.
There's an emotional level here that, especially if you're dealing with a serious illness. And what is the relationship like between you and the patient and the caregiver and the family?
Well, when you're getting palliative care, it's a lot deeper, I think, than it can be in a 15-minute office visit. You know, the palliative care team can spend hours with families and patients, really get to know them, know what their needs are, really get to know the backstory of their lives. And so I think, again, having the extra time is wonderful.
Mm-hmm.
It really helps.
I know that there's absolutely a level, especially you as a doctor, right? I mean, you have the benefit of all the medical experience, but you also then are able to bridge working together, right?
Yeah.
To be able to say, all right, this patient has a specific need. You recognize that need,
Right.
and you start to address that need.
Right. So oftentimes I'll have a patient that I feel needs an extra layer of support, and that way I can refer to Mary with a specific goal in mind, and then she can take the ball and run with it.
Yeah, I got you. Boy, that sometimes can be a pretty big ball to run with,
Yeah.
right?
At times.
I bet. You mentioned something to me before we started rolling here, that you'll go to a patient's home. And the first thing that struck me about that, Mary, was just the thought, boy, you learn a lot, right?
Yes.
Give me a sense of what that's like when you're invited into a home.
It's completely different than being in the center, needless to say. This is familiar to me, right?
Yeah.
I know this chair, I know the people that are sitting at the front desk. You walk into someone's home, you're their guest. And it's very different because you see what's important to them. You see the art that their children made for them.
Yeah.
You see that their hospital bed is now in the living room and there's no couch. You see things that they've created to make themselves more comfortable. And you also see where the stress is in their home.
Sure. You just think about so many unanswered questions when your level of anxiety gets to that point, right? Where you just don't have answers to some things. Or you're rearranging the furniture. You had mentioned something to me really stuck in my head. Somebody might not have running water.
Yes.
Now, some of those kinds of things, very hard for us to sort of relate to, but that's where the need for this kind of care really comes in. My mom is going through hospice care. A lot of times it seems like there's a crossover here, Sue. Is hospice care part of palliative care?
Yes, it's a small part. I think there's a misconception that hospice and palliative care are the same thing. So the way we think about it is hospice is a very small part of palliative care. We like to start palliative care well before people are at the end of life. We like to start palliative care when someone has a diagnosis of a new serious illness.
Right.
Whereas
Well,
hospice is for the last 6 months of life.
Yeah, I've got it. I want to cycle back on that because this is important. You would tend to think that, and of course we're covering issues in this series related to seniors, but seniors, their caregivers, and their families, so we're moving across all demos. But one of the most important things about palliative care, it's not just for any particular age demo, right? You could be a child. You could be anybody in need
Absolutely.
of this kind of care. Say you're suffering from any number of serious illnesses.
Pediatric palliative care, adolescent palliative care, it is across the age demographics.
And you
Absolutely.
see all of this, do you?
I think my youngest patient at this point is about 25.
Wow.
Yeah, but we have several people who are in their 20s who have MS. I have a patient who's about 42 who has MS.
And I can imagine that, again, that's not age specific, the kind of anxiety that somebody might feel, the distress that they might be under, the family might be under, the stress involved with this.
The symptoms and stress.
Sure, I bet it is. It seems to me that overriding all of this is healthcare serves the community best when it's individualized. And that given the fact that you can always go to your primary care doctor and they can be diagnosed and whatever, but I would imagine that the communication you have, your ability to listen and understand people at a deeper level would help individualize that care. Would you agree? And could you give me an example maybe?
I think it does. Palliative care can be, primary care provider or specialist can refer to us. Even one of the nurses in the centers can say to the provider, how about a referral to palliative care? So anyone can generate the beginning of that referral, right? But the actual referral can come from a provider. I think an example is, as Sue said before, it's time. It's having the time to be able to see what's causing the patient to not be the person that they want to be, the patient they usually are. What is keeping them from doing that? If they love to go to the movies, but no one's noticed, or they didn't know that they could get a portable oxygen machine, it takes time to get to that. It takes time to get to that conversation needs to develop, and that takes time.
That's really well said.
So
It really is. Because, you're drilling down there to the level that, as an individual, we all have these sort of needs and wants and desires, and we also have the things that help us cope.
Yeah.
And understanding what some of those things are that help you cope can also contribute to your well-being.
Absolutely.
So give me an example. So you'll come back to Sue and say, I'm talking with so-and-so, and I've spotted this. You would generally grab it from there and try to form some kind of a, I'm going to say this
Yeah.
in a layman's term,
Right.
A program, a path.
Sure. It depends on the situation, but if Mary came up with a treatment plan for somebody and she then asked the patient to come back to me, I'll follow the treatment plan. If I need more help, I can easily get a hold of her and get some more expertise. So, but again, it varies so much individual to individual. Sometimes I'll refer someone to Mary to have a conversation about advanced directives, healthcare proxies, living wills, and then most forms, medical orders for life-sustaining treatment. So that'll be a one-off consultation, and then we'll just go from there.
You're dialing in an area too. There, many of us, especially as we get older, you think to yourself, oh my God, have I thought about my will? Have I thought about this? Have I thought about that? That's part of this as well,
Yeah.
right? And making people aware, making people comfortable that they're making the right decisions, or giving them the opportunity to vent, giving them the opportunity to have someone who will actually care to listen to what they need. And again, that all contributes to your well-being. I really encourage everybody, I don't care what age you are, whatever, we all either suffer from a serious illness ourselves or a family member, and find out more about it. You've seen the website on the screen here, so you know how to contact them or contact Hudson Headwaters Health Network. I always have to say HHH,
Yeah.
but
Yeah.
It's much easier.
it's so much easier to do it that way. But you've heard me say this many times because we interface with them. They just have such a unique approach to what healthcare means in a community, and going out in the community and finding out where, what people need. That's a very, very interesting model, and it sure beats a lot of other models. I just really want to thank you both for giving us more information about this. You're both very well suited for this, I can tell. And it's wonderful, and it really provides an amazing service. Thanks.
Thank you for giving us
Thank
the
you.
opportunity.
Oh, you're welcome.
Yeah, we appreciate it.
To see this interview again, you can head to our website, looktvonline.com.
A Look at Seniors is underwritten by the generous support of Hudson Headwaters Health Network, dedicated to provide the best health care and access to that care for everyone in our communities. Serving all of Warren County and parts of Clinton, Essex, Hamilton, Saratoga, and Washington counties. A Look at Seniors is underwritten by the generous support of Retirement Solutions. Our knowledgeable and experienced team will help you explore retirement options for a smooth financial transition toward a secure, comfortable, and worry-free quality of life. Retirement Solutions, providing you with a greater peace of mind when it's needed the most. A Look at Seniors is underwritten by the generous support of the Wesley community. For nearly 45 years, the Wesley community has provided services and programs with a commitment to compassion, caring, and excellence. The Wesley community, a senior living community that feels like home.